All right, welcome in, everyone. Thank you so much for joining us today for the launch of the third Tobacconomics supplement with the Tobacco Control Journal, which is titled Economics of Tobacco Taxation in Low and Middle Income Countries, Part 3, New Evidence from Tobacconomics. My name is Margaret Jorkina, and I am the Communications Director on the Tobacconomics team. I'm excited to welcome you all to the webinar. I would like to start off just by thanking all the folks at Tobacco Control and associated with the journal that helped to bring this supplement to life. And we want to especially thank the guest editors, Mark Goodchild and Cornée van Welbeek, for the role that they played over the past 2 years. So it's an enormous amount of work and commitment from them, and a simple thank you is insufficient, but we really appreciate it. And then our discussion today will be moderated by Dr. Jeffrey Drope, who is the Director of Tobacconomics and a research professor at the Johns Hopkins University. Jeff has been working in the area of economics of tobacco and tobacco control for nearly 20 years, both as an academic researcher and in a previous role leading the economics research program at the American Cancer Society. Jeff has worked collaboratively across dozens of countries on many tobacco control issues, including taxation, illicit trade, and tobacco farming. We will feature 3 studies from the supplement today, so we'll hear from the authors of each study. The first speaker will be Dr. Alejandra Macias Sanchez from the Centro de Investigación Económica de Repostería in Mexico. She holds an economics degree from UDLAP and a doctorate in public policy from the School of Government and Public Transportation at ITESM. She has worked in the federal government and international organizations. She has experience in evaluation, public finance, social security, and social development, on which she has published. She's a candidate for the National System of Researchers, and is currently the executive director at CIEP. She specializes in demographic change, public finance, and just transportations, with a particular interest in improving the fiscal system based on evidence and a gender perspective. Next, you will hear from Dr. Dragan Gligoric from Bosnia and Herzegovina. He is an associate professor and vice dean for scientific research at the Faculty of Economics, University of Banja Luka. He is also a member of the supervisory board of NLB Banja Luka. His areas of interest are exchange rates, foreign direct investments, innovation, internalization, economics integration, health economics, and applied econometrics. He's a part of the Tobacconomics think tank project since 2018 and the principal investigator of the research team for Bosnia and Herzegovina. He participates in numerous international, regional, and national scientific research projects. And our other presenter will be Dr. Teguh Dartanto from Indonesia. Professor Teguh Dartanto currently serves as the Dean of Economics of Faculty and Business at the University of Indonesia and is a former Tobacconomics think tank's project director at the Center for Indonesia's Strategic Development Initiatives in Indonesia. He obtained his master's degree in economics from Hita Subhashi University and a PhD in international development from Nagoya University. His research expertise includes the topics of poverty analysis, social protection, development economics, and health economics. He was actively engaged in research collaborations with both domestic and international research partners, such as JPAL, Southeast Asia, the ANU Indonesia Project, and the Asian Development Bank, UNDP, JICA, and OECD. And then we will have time for questions and answers after the presentation, so just be sure to use Q&A box for your questions and any comments. I just want to start off by providing some background on the supplement. So this is our third supplement with the Tobacco Control Journal. In each supplement, we include new research from our think tank partners, as well as an overview article where we step back and discuss our partnerships with think tanks from a broader lens. And I will talk further about these experiences and the progression from 2017 on the next slide. Our latest supplement includes 14 studies from 12 research groups in 10 countries. And these studies cover a variety of topics relating to the economics of tobacco taxation in low and middle income countries. Today, we'll be hearing more about the impact of tobacco use on household spending and poverty, economic costs of cigarette smoking, and the macroeconomic effects of tobacco taxes on employment and outputs. Other studies that you can find in the supplement examine youth smoking initiation, price elasticities and demand for cigarettes among different groups and product tiers, regional tier trends in affordability, and the illicit cigarette market. Now I'm going to dive further into the overview article in our supplement, which is titled From Capacity Building to Collaboration in Tobacconomics Research. So the Tobacconomics Think Tank project began in 2017. Since then, we have worked with more than 40 think tanks in over 20 countries, helping to build capacity for research and dissemination amongst our grantees. Our goal has always been to grow the local evidence base and inform more effective policies while prioritizing equitable relationships and sustainability. We continue to fine-tune our relationships to ensure that we are best supporting our partners in the production of high-quality, timely, and impactful economic research. With many of our teams, we are naturally able to progress from capacity building to collaboration on research deliverables over these years. Through some trial and error over the years, we have found the following 7 facets are crucial to our work. First and foremost is the selection of our institutional partners. So great candidates should be highly motivated and have existing economic research capacity and a demonstrated ability to reach policymakers. They also cannot have ties to the tobacco industry. Unlike many capacity building initiatives, we also strive for longer-term investments with our think tanks. This allows for more complex research endeavors and even transitions to research hubs led by the partners. These long-term relationships with partners allow us to build the necessary rapport and technical capacity to begin collaborating on research. Third, a cultural and environmental sensitivity is essential and very valuable in this kind of work. We prioritize general multicultural point of view, as well as seeking to understand the specific challenges that researchers in low and middle income countries may face. We are also very cognizant of spending the necessary time establishing expectations and timelines in the scope of work with each partner. This helps to ensure that there is a mutual understanding and clear understanding of the roles and responsibilities on both of our sides. On a similar line, regular communication with the think tanks is essential to our work to build professional relationships and a personal understanding between our team and the think tanks. This helps to make sure that we stay on track with deliverables and are able to support research groups along the way. We also recognize how valuable local partners are in setting research priorities, since they are most familiar with the local political climate. Often this means including other stakeholders in discussions to coordinate our efforts and ensure timely and relevant evidence is produced. Finally, authorship is a key tenet in our relationship with think tanks. Since the start of the project, we prioritize local ownership of final products and focused on providing extensive guidance behind the scenes. Recently, however, we are beginning to be able to co-author with groups on select outputs, transitioning to more peer-to-peer collaboration in cases where it benefits the research group. So that's just some background on our overview article. And now I will pass it off actually to Dr. Dragan Gligoric for his presentation. I think you're on mute.
Can you hear me?
Yes, perfect.
Yeah. This research we made 2 years ago, and it is related to the measuring economic cost of tobacco use in Bosnia and Herzegovina in 2019. And this research is produced by me and also my 2 colleagues with support of Tobacconomics. Next slide, please. Regarding the Bosnia and Herzegovina ranks 11th in the world in terms of smoking prevalence. So smoking prevalence in Bosnia and Herzegovina is very high. Among adults, it is about 41%, but also not only smoking prevalence is very high, but also smoking intensity is very high. The data shows that more than current smokers smoke more than 20 cigarettes per day. So these findings suggest that the population in Bosnia and Herzegovina is susceptible to the development of smoking-related disease. So our aim was to measure the economic cost of tobacco use in Bosnia and Herzegovina in order to make some recommendation for our policymakers in order to take a measure directed toward decrease smoking prevalence and as well as smoking intensity. Next slide, please. The economic cost of tobacco use consists of three different parts of cost. The first part is direct cost of smoking, incurred for treatment of smoking related illness. It includes inpatient hospitalization, outpatient visit, treatment abroad, which is common in small countries such as is Bosnia and Herzegovina, drugs, and also non-medical cost. The second part is indirect morbidity cost. It is the value of lost productivity due to absence from work because the patient or smokers is absent from work due to smoking-related disease, and it imposes significant cost for society in Bosnia and Herzegovina. The third part is indirect mortality cost of smoking. It is economic value of life lost due to premature deaths. Next slide, please. Our methodology is mostly based on WHO methodology published on 2011. We made calculation of economic cost for all disease and also for smoking related disease, and estimation for smoking related disease we use as robustness check for our results. The two most important data for calculation economic cost of smoking is the relative risk. It is the risk of developing particular tobacco-related disease among ever smoker to never smoker. The second important data is smoking prevalence. So we have our data for our country for smoking prevalence because we collect that data in 2019, but relative risk in Bosnia and Herzegovina is not available. For that purpose, we use the relative risk for other country where that data was available, such as from Russia, Belarus, Hungary, and also from United States. So after choosing relative risk and smoking prevalence, we calculated smoking attributable fraction. It is a fraction of burden of economic cost and debts which could be attributed to smoking. Next slide. When it comes to direct medical costs, since Bosnia and Herzegovina has a very complicated administrative organization, it consists of Republic of Srpska, Federation of Bosnia and Herzegovina, and Brčko district. So we have 3 territorial units. And also among Federation of Bosnia and Herzegovina, we have 10 cantons. Each of these territorial units has his health insurance fund who track and collect the data about the medical cost. So these things make our job very complex and very hard from the point of view collecting the data. Direct medical cost is sum of medical cost at primary, secondary, and tertiary level, including also drugs and treatment abroad. But also direct medical costs don't only contain medical costs. There is also non-medical costs such as transportation and caregivers cost. And we in Bosnia and Herzegovina, we don't have the estimation of non-medical cost nor any evidence about that cost. So we use the average share of non-medical cost, indirect cost from similar studies. Also, according to estimation of WHO and the World Bank, the out-of-pocket cost is very significant part of cost in Bosnia and Herzegovina. It is about 30%. So we also included out-of-pocket costs when estimating the direct medical cost. As I said previously, we estimated data for all disease and also for smoking-related disease. The main problem in data collection was that only 1/3 of territory of Bosnia and Herzegovina, or only health insurance fund in Republic of Srpska was digitalized, so it tracked the data about the medical cost per patient, per age and gender. So we only have the precise data for Republic of Srpska, and we were forced to make approximation for Federation, Bosnia and Herzegovina, and Brčko district based on the shares of cost per age group and gender in Republic of Srpska. Next slide. The next part of cost is indirect morbidity cost. It is loss of productivity due to absence from work caused by smoking-related illness. Indirect morbidity cost is the product of smoking attributable fraction. Total days lost from due to smoking-related illness and monthly earning. Also here we have a lot of challenges in collecting the data. We create the data about the loss of about the date absence from work, from inpatient hospitalization database, because if somebody is hospitalized, he or she is not able to work. So the people who were hospitalized was out of work for that days. Also, we corrected that numbers by labor force participation. The next database which we include in our estimation is disbursement for workers database, because in our country, employee who are sick more than 30 days, their salaries is reimbursed by health insurance fund. So we collect also this part of the data. Also, we receive the data about salaries from tax authority, and also we correct the formal employment by including also about 30% of informal employment in Bosnia and Herzegovina. The second part of indirect cost, or third part of economic cost of smoking, is mortality cost. So these costs consist of we calculated this cost by using total numbers of dead multiplied previously by SAF, and after that by present value of lifetime earnings. For this part of analysis, we have full data from each part of Bosnia and Herzegovina. In this part, we have used a lot of different data, such as data about the productivity, data on salary, data on mortality, etc., etc. Next slide, please. I talk about the morbidity cost, so we can go on the next slide. Here we have estimated smoking attributable fraction for Republic of Srpska. We can see that when we use relative risk from United States, the smoking attributable fraction is estimated between 27 and 52% among male, and between 26 and between 25 and 35% of when we estimate relative SAF for using by using RR from United States. But when we use Belarus RR, which is more similar to Bosnia and Herzegovina, the smoking attributable fraction among male is between 70 and 37%, while among females is between 11 and 20%. Next slide. On this slide, we can see smoking attributable fraction for the second part of Bosnia and Herzegovina. It is Federation and Brčko district, and here because of lower smoking prevalence in this part of country, the smoking attributable fraction is about 10% lower when compare it with the data obtained for Republic of Srpska. Next slide, please. Now we arrive to the estimation of the economic cost of smoking in Bosnia and Herzegovina. The direct cost of smoking is estimated at 5 when we use Belarus relative risk. It is estimated at the level of 557 million of Bosnian mark. One Bosnian mark is about 0.5 euros or $0.6. So it is approximately $280 million. So the total economic cost is, direct economic cost is 557 Bosnian marks, and 2/3 of this cost is caused by males who are smoker. It is 337 million, while female participated with 219 million of Bosnian mark. Indirect morbidity cost is estimated at 50 million Bosnian mark, while indirect mortality cost is estimated at 110 million of Bosnian mark. So the total economic cost of smoking estimated by using Belarus relative risk is 718 million of Bosnian mark, where 2/3 is related to the smoking among male and 1/3 is related to the smoking is caused by smoking among females. Next slide, please. Also on this slide, you can see average estimation when we use relative risk for Russia, Belarus, and Hungary. And since relative risk in Russia and Hungary is higher than relative risk in Belarus, this estimation gives the higher economic cost of smoking. It is about 831 million of Bosnian mark. You cannot see that number on this slide, but I know that number by heart. The largest part of economic cost of smoking is direct economic cost with the participation of 78%. 7% is related to the morbidity cost and 50% is related to the mortality cost. Next slide, please. On this slide, you can see the estimation of economic cost of smoking by using different RR, and this is average 831 million. But when you're using RR from United States, the total economic cost is 1.2 billion of Bosnian mark, which is very high, and it exceeds the amount of money collected from our tax authority on smoking excise and value-added tax. Next slide, please. Also, we estimated economic costs not only for all causes of disease, but also for only smoking-related disease, and that estimation gives the amount of total economic cost of 362 million, where 2/3 is related to the treatment or deaths among male and 1/3 among female. Next slide. Based on this research and findings, we created some recommendation for our policymakers. It is very useful to know that in Bosnia and Herzegovina, the policymakers introduced the specific excise in 2009, and each year they increased specific excise by 0.07 euro per pack of cigarette, but in 2019 they decided to stop with increasing in excise taxes. So our first recommendation is that our policymakers should to continue with regular increasing of tobacco taxes, which will decrease consumption of tobacco, but also exposure to second-hand smoke, encourage smoking cessation, discourage smoking initiation, but also raise tax revenues. The next recommendation is that our government should stop considering tobacco excise only as a revenue instrument, but also the excise should be used as a tool for decreased tobacco use, and the portion of the money collected through taxation should be allocated toward public health, including tobacco control, including financing tobacco control measures. Also, the government should improve implementation of other tobacco control measures, such as enforcing smoking-free areas in public spaces, utilizing influence on mass media and social platforms, and also expanding the use of visual health warnings. The fourth recommendation was related to the health insurance funds. We have 13 such funds in Bosnia and Herzegovina. They should provide increased resources for comprehensive cessation program. The last but not least recommendation was related to the recording of smoking status in the health file of every patient. So in that case, cost of tobacco can be tracked better. So we will not estimate that cost. We have precise data about the economic cost of smoking, and in that case, the policymaker will see the difference between tax revenue and economic cost of smoking or cost caused by smoking in our country. The next slide is related to our limitation. Our paper has three main limitations. The first limitation is that in our country we don't have RR estimates. Also, the health data is health insurance fund, and their database here is not digitalized in whole Bosnia and Herzegovina. The third limitation of our research is underestimation of indirect morbidity and indirect mortality cost, because wages are underestimated in our country due to tax evasion by employers. We have a lot of significant portion of enveloped wages in our country. The third limitation is which causes the underestimated indirect morbidity and mortality cost is very low level of productivity and wages Bosnia and Herzegovina, which causes the very small indirect economic cost of smoking. And third limitation is that employed persons who were sick, who were on sick leave for fewer than 30 days and were not hospitalized are not included in morbidity cost estimation, because we didn't have the chance to estimate this part of cost. Thank you for the attention. Any questions, comments?
Thank you, Dragan, for that great presentation. We'll save the majority of the questions for the end, but I know you talked about a lot about the challenges you faced with getting the data that you needed. So I was wondering if you could share any other insights on kind of the lessons that you learned that could be useful for other researchers working on this who may be facing kind of these data challenges.
Thank you. The first challenge, as I said, is data collection, especially the healthcare costs. But we were lucky because 1/3 of health system in our country is digitalized. I think it is not the case in other countries, Western Balkans. So if researchers come from developing or least developed country, they should be aware that maybe the data on health claims are not collected digitally, and if they are not available per patient, per age group and gender, this kind of research is not possible. Also, in calculation of economic cost is not too complicated, and neither is the methodology, but there is a lot of possibility to make such kind of mistakes because you are working with a layered database, mostly in Excel, so you can make some mistake during the calculation. So we should be very, very carefully when calculating this cost. The third thing, which is very important, is that a researcher who want to estimate this kind of, who want to make this kind of analysis must know well the cost in healthcare system and the process of collecting them. So in that case, some important ones will not be left out in analysis.
Thank you so much. And then, yeah, as I mentioned, any other questions, feel free to put them in the chat box. And now I will pass it over to Dr. Teguh Dartanto for his presentation.
Okay, thank you very much. Very good morning, those who are in US, and very good afternoon or night in Jakarta. I would like to share about the macro, our publication on the tobacco control supplement. This is the second publication that I'm as the principal. This is the last one, and not the last year publication about the macroeconomic impact of the tobacco taxation in Indonesia. Next. Okay, and this is just the paper that you would like to download. Next. Okay, this is the outline that I would like to share, but I'm trying to be very brief. Introduction, analytical framework, IO table, and the introduction that I would like to share is that next for the introduction. Okay, next. Okay, in Indonesia, why this is very important to conduct this study? Indonesia is one of the highest smoking prevalence in the world. And many studies already shown that the increasing the tobacco tax is a one way to effectively reduce the tobacco consumption, both in developed and developing countries. But the problem is that in Indonesia, the tobacco industry is one of the main industry, and the top 10, the richest people in Indonesia, the conglomerate is having like the tobacco industry. That's why it is very, very difficult to convince the government to massively or significantly increase the tobacco tax, because there is many how to say, pressure for the government from the health or for the tobacco control activists, and at the same time there is also the pressure from the industry. Industry always saying that if you increasing the tobacco, then the impact is will be reducing the economic growth and reducing the employment, etc., etc. Then the government afraid about that. That's why we have in as the network for in Indonesia, the tobacco control network, we're trying to provide the evidence, the strong evidence that the Ministry of Finance, those who are in charge for imposing the tax, about the impact of if we raise the tobacco tax, does not necessarily reduce the economic activities. This is the reason of this, the motivation of this paper. Next. So this is the analytical framework at that time, and how we try think how to create the robust and also how to say the result that can convince. Now we're trying to combine next, and the two models means that we're trying to combine between the micro level analysis and also the macro level. So in the micro level, we're trying to analyze what is the impact of the tobacco tax increase on the price increase, because when you increase the tax on the tobacco, the price of tobacco will increase. So this will change the tobacco expenditure. At the same time, when you charge or increasing the tax, tobacco tax, and the government will increase their revenue. So this is the idea when you change the tobacco expenditure and will reduce the consumer demand on the tobacco, but at the same time, the household can reallocate the household spending on tobacco into the other commodities. And then for the if the government have additional revenue from the taxation or the tobacco tax, then the government can there's some certain amount of allocation of the tobacco taxation. For example, this is for health expenditure, this is for the local government, and there is some how to say mandatory spending result as a result of the tobacco tax increase. So this is based on this behavior. We're trying to calculate the macroeconomic impacts. What is the impact on the output? What is the impact of the employment in the economy and the income? And why we're trying to combine this? Because if we would like to measuring the impact of the tobacco taxation on the tobacco industry on the economy, we need to have the macroeconomics modeling. Means that because the tobacco industry has backward linkage and the forward linkage, means that in Indonesia is the producer, and then if you increase the tobacco tax, there is possibility the decrease of demand, if the decrease of demand and then decrease of the demand for the raw material or something like that. So we have to calculate more comprehensively, and that's why we're trying to combine between the micro level analysis and also the macro economics level analysis, so we can measure more comprehensively. Next. So the issue is that the challenge is that when we modeling of the macroeconomic impact that links intra-industry linkage, the challenge is in Indonesia that we don't have like the input-output table. Input-output table is like the table that capture the economic equilibrium between sector in the economy. The latest data that we have at that time is 2010, is almost 15 years ago, if we calculate from now. And then in the model, in the input-output model, the tobacco industry is aggregated into one sector. So this is not good because in Indonesia there are many category of the tobacco industry, and then we're trying to update the data of the input-output to capture the real condition with the current situation. And we're trying to update the input-output table using the 2019 data at that time, because this is the latest data, the comprehensive data that we have. And then we disaggregating the tobacco sector into three categories: the white cigarette, kretek cigarette. Kretek is maybe this is the Indonesians, not the traditional, is most likely they use the clove in this cigarette and the other tobacco. So this is we're trying to update this to capture the real condition of the macroeconomic condition in Indonesia. Next. And this is the data we use to update the input-output by sector, and then we're trying to use the National Labor Force Survey for updating for the employment data, and for the household consumption using the National Socioeconomic Survey, and for disaggregating the tobacco sector, we use the manufacturing industrial statistic in 2017. We are the different years, but we're trying to make the updating the data, especially there is no much changing in the structure of the industrial in tobacco. So the industrial statistic, the latest one is at that time is 2017. Okay, this is that we update data first, and then next. And the issues that this is the one of the issues that we face at the macroeconomic modeling. But the other thing in the macroeconomics, in the micro household level issues, is that how to link between the tax rate and the retail price. So this is the discussion is there like the producer like the pass through all of the tax increase into the price or not? So there is like some discussion at that time, the discussion with the team from the Tobacconomics. Which one is better, using the undershave or full pass-through or overshave? And then we agree that in the context of Indonesia, looking at the historical perspective, most likely the producer will pass through the tax rates into the retail price. Okay, next. And then this is that in Indonesia also that there are many layers, many types of the cigarette, and also the many types of taxation in Indonesia. But for simplification, why we simplify? Because the data in the input-output table is also only three categories of sector. So we're trying to make the simplification of the price of the cigarette price and white cigarette with the difference. We're trying to make the weighted average the price, and also the weighted average of the excise. Based on this data, we're trying to model of the how much the reducing of the tobacco consumption and also the tobacco spending. Next. So this is also the issues that to estimate the decreasing demand on tobacco is about the elasticities, transferring from the retail price to the demand. The issues is also very difficult to find the robust studies on the on-price elasticities and also the cross-price elasticities. That's why we survey several publication in case of Indonesia, and we take the median, or also something like we use the average. And we make the strong assumption here. Yeah, this is the first step of we modeling the macroeconomic, and we trying the first to not make the complicated. We make the assumption no change in income level, no change in the illicit cigarette rate, and no substitution to the cheaper brand. In Indonesia, we have a lot of the tobacco brand, and people can easily sometimes can easily to switch. But we believe that the tobacco taste is the people cannot easily change one brand to another brand. So we make this assumption. Next. So this is our simulation how to reallocate of the additional tax revenue, the government. We're trying to make the reallocation. The first simulation is 2% of additional excess revenue, and then 100% of the additional subnational cigarette revenue are allocated to the mandatory sectors. And then we're trying to have the different scenario of the government reallocation. Yes, following the mandatory and combined with the JKN is the health sector, health insurance, and non-JKN sector is non-health insurance. So we're trying to combine this many things, which sometimes also we reallocate to the social assistance program. There are several simulations and that we've done. And next. And what is the result? Next. So the result is quite surprising in the case of Indonesia. When we increase the tobacco tax, because it's very inelastic. For example, in Indonesia, the change of the cigarette demand, for example, increased 20%, around 20% in 2020, 30%. We make the simulation of the tax increase. The price is and the demand is decreased is less than half. So partly, yeah, close to less than half. So the price elasticity. That's why even though the tax increase and the cigarette demand is increased less than is inelastic. That's why in the term of the cigarette spending still increase, because the volume is decreased, but the decrease is volume is less than the increasing the price is net. So the cigarette spending in the economy is still increasing. So in the term of stick is decreased, but the term of the money, the value is increased. And the government also increase the revenue, and from the tax is increased 8.2%, 10%, and 15.6%. So this is that we use to make the simulation in the macroeconomics modeling. Next. So this is the result. I think my focus is not on mainly on result, but I would like to more talking on the methodology side. But this result shown that the increasing the tobacco tax, this is how to say this, the black one is net effect. So it's combined between the cigarette spending increase, non-cigarette spending decrease, and the government spending. Means that as I mentioned previously, that the increasing of tobacco tax reduce the stick the tobacco consumption, but in the term of the spending is increased. So there is also impact on spending increase in tobacco and in the economy. But when you increase your spending in tobacco, means that you have to reduce or reallocate your spending from the other sectors. That's why resulting of the negative non-cigarette spending. At the same time, there is also the government reallocation. It's a reallocation not reallocation, sorry, because the government in having the increase the revenue, and government can spend in the several spending in health, in the mandatory spending, or even with the social assistance. At the end, the net effect is still positive. Means that increasing of the tobacco tax is still generate a net positive impact on the economy. in the term of the economic output, household income, and also the employment. The positive impact is mainly driven by the government spending from additional revenue from increase the tobacco taxes. So this is the main message, that don't be worried with the increasing the tobacco tax. In the net effect in the economy will be bettering if you charge the tobacco tax or increase the tobacco tax. Lastly, this is our conclusion. Next. Okay. This is our conclusion that, as I mentioned previously, that before that, I think it's the one slide before this. Could you go back? Oh, okay. Next. Yeah, this is the main message. Okay, the last one, that next. Okay, the conclusion. Next. Okay. As I mentioned previously, that the increasing the tax, tobacco tax is not really harmful to the economy. This is against or can convince the government that the claim of the industry not really correct. This is the message. And then this is also support that in implementing the higher cigarette tax is important to significantly reduce the consumption and in the long run reduce the economic burden. As because in our previous publication also in the tobacco control supplement, that the smoking cost in Indonesia is up to 2.6% of the GDP. We do the similar thing with the presentation about the economic cost. So I think this is good way to increase the tobacco taxation in Indonesia, and don't be really worried about this policy will harmful to the economy. So our study clearly said or clearly conclude that increasing tobacco tax no negative impact on the economy. Thank you very much.
Thank you so much, Teguh. And I think we'll hold the discussion question until the end in case we have extra time, just for sake of time. And now our next presentation will be from Alejandra Macias Sanchez. So if you want to pass it over to you.
Thank you very much, Margaret. And I'm very sorry I had to leave for a while. You know, the childcare work doesn't stop. So I'm going to be very quick presenting our paper, and thank a lot Tobacconomics, especially Jeff and Carlos, for guiding us to do this paper, to grade this paper. Next, please. So I think we know the relevance of the topic, and I think we all have heard these reasons. No, tobacco is one of the world's largest preventable causes of premature death. And this work is based on the idea that a household has a limited budget, and means that tobacco spending can crowd out spending on other types of goods and services. And tobacco spending can cause households living near the poverty line to fall below by subtracting tobacco spending from their income. So this is the main ideas that guide this work. Next, please. So the objective is to be the first, as far as we know, this is the first study in Mexico about these topics. So the objective is to be the first study to generate evidence on the effects of smoking on household expenditure and the number of people living under poverty threshold by studying the crowding out and impoverishing effect in Mexico. Next, please. What we do, I'm going to talk very quick about the methodology. The next, please. It is about maximizing that utility function, and when you do that, you get the demand function. Yeah, you get Sorry. The demand of goods in the household, and this demand function of any good is conditional on the prices of all commodities except the conditioning good, that in this case would be tobacco, total remaining spending after deducting expenditure on conditional good, that is tobacco, and the quantity of the conditional good, and a vector of household characteristics. So an increase in expenditure on tobacco caused by an increase in taxes may influence expenditure on other goods and service goods. Next, please. So the crowding out effect refers to this estimated variation in the consumption of various products and services caused by an increase in tobacco expenditure. The variables we used are food at home, food outside the household, education, housing, entertainment, transportation, durable goods, health, and alcoholic beverages. So these are the main variables used in the model. Next, please. And we also use these variables as instrumental and control. And this is a natural logarithm of total household spending, a square of the previous variable, number of inhabitants in the household, average years of education, and well, you can look at them when they share the presentation, and also we can share the paper. Next, please. What are the results? Well, mainly, this is the descriptive statistics. What we used for this paper is information from the income and spending or expenditure household survey in Mexico in 2020. In fact, there's a newer one, but this paper used the 2020. So what we see is the total spending, and I'm sorry that this table is in Spanish, but the first variable is the total spending, and after that we have the variables that I explained earlier or before. So in total we have that 5.2% of the households smoke or spends in tobacco, and there are proportions of how much they spend in food inside the household, food outside the household, etc. And also we divide the analysis in three types of household according to their income. So we have low income, medium income, and high income. So we can see how the crowding out looks like in each of these groups. Next, please. So the results are that when there's an increase in tobacco expenditure, there will be an increase in food as inside and outside the household. The alcoholic beverage will increase also, entertainment, transportation, and durable goods. And on the other hand, we would have a decrease in health expenditure, education, and housing, clothing, and others. By income level, in low-income households, an increase in tobacco will distort spending in food, within the household, entertainment, and housing to a greater extent, but there is no significant difference between income groups as far as the crowding out of health and education regards, and alcoholic beverage. That means that always it doesn't matter the income level. When you spend more in tobacco, you will spend less in health education and more in alcoholic beverages. Next, please. This graph shows the monetary values of the exercise, and here it's more clear how an increase in tobacco expenditure will increase alcohol consumption and will decrease education and health. And this is you can see the bars, right? And also in housing. And in housing it's a deeper effect for the low-income households, and the alcohol beverages is almost the same proportion for all the households, right? So I think this is very interesting because we can see the differentiated effects between income, and it is worrying that a household that spends more in tobacco is going to invest less in human capital, right? Next, please. Now about impoverishing effect, what we have next is we are going to use the headcount ratio indicator that tell us when a household falls below the poverty line, and we use also information of the income and expenditure household survey. Next, please. These are the variables: household health expenses, consumption, the size of the household, extreme poverty line calculated by the entity here in Mexico, the official entity that measures poverty, medical cost, and includes public and private costs, right? Next, please. And these are the results. What we have is the first line is the number of persons under the poverty line. The next line is persons under poverty line considering the tobacco expenditure, and we can see there is a change in 167,000 people that goes below the poverty line. When we take in account the health expenditure attributed that comes from smoking, this number goes it increases even more. And when we have the combined effect, it's expenditure in tobacco and expenditure in health, we have almost 1 million persons that goes below the poverty line. So we have these two effects by tobacco consumption, that is the crowding out of essential essential goods in the household, and for the young, this could be even a tragedy if they don't have sufficient health and sufficient instruction and education. And the other effect is the impoverishing that can drive 909,000 people below the poverty line. And I think I have another slide for the key messages. But well, tobacco spending does change the level of consumption of other groups across all income level households. The expense on important and basic needs such as health and education are reduced with tobacco consumption. Goods, some of them harmful to health, like alcohol, increase their consumption. And last, tobacco consumption has an impoverishing effect in Mexico. So this is my presentation, and thank you very much.
Thank you so much, Alejandra, for that presentation. And then we do have a discussant here from Montenegro. And they also worked on a similar study on crowding out. So I have Mirjana Cizmovic with us today from the Institute for Socioeconomic Analysis. So I was wondering if you could add just your experiences, how you think your research was similar or different, what challenges maybe were similar or different. So I'll pass it over to you.
Okay, thank you, Margaret. Hello to everyone. I just at the beginning want to congratulate to our friends from Mexico on their great work on this research and also for very informative, insightful presentation. Motivation is almost the same. Let's say in each country we have also the high percentage of the people under the poverty line. That is one of the main reasons to see how what is the effect of tobacco spending on let's say crowding out and also impoverishing effect. So this is the main motivation. And also when we're talking about methodology, again, more or less is the same. I suppose the day as we also had some challenges regarding finding appropriate instrumental variables. So we had to use someone beside this traditional one, like a prevalence by the municipality or the intensity of smoking, etc. And what is also, I can say maybe the main difference, because we all know that in other researches, there was inconclusive effect of tobacco spending on food. As we can see in the research from Mexico, it was, let's say, the positive. They explain why and how why it is like that. But in our case, we actually disaggregated this this commodity on 11 sub-commodities, and so the different effect of all of them. Because again, Montenegro has some specificities if we compare it with the other countries. We are a small country, and also the sample, like in Mexico, they had a big sample for 1 year. We had to use a longer time series because again, we have to have a long enough sample, big enough sample for our analysis. And for the end, I just want to say that I suppose that's the same thing in each country that did this work, this research. That results from this research are well accepted by the general public, journalists, and also the policymakers. They are usually clear, easy, they understand it, and they like to use it. When you say the effects of the tobacco is, I don't know, that it crowds out some necessities, on the other side that it's crowd in using of some non-healthy things like alcohol or things like that. So it is something what is, again, I said, well accepted and easy to understand. So this research maybe is the one that is maybe easiest to promote and the well accepted by general public and other stakeholders. So that's from my side. Thank you.
Thank you so much for adding your input and this perspective from Montenegro. And then now that concludes all our presentations. So I'll just pass it over to Dr. Jeffrey Jones for just some concluding remarks.
Thanks, Margaret. I want to thank everybody here today, the presenters, for these phenomenal presentations, and to Mirjana for her discussant role. And I want to more broadly thank all of our collaborators on this broader think tank project for really the phenomenal research that has been generated over the last 6 years or so. I believe that a really impressive foundation of important tobacco control research with an economic focus has been generated by this group of researchers, and it really is quite exceptional. And I think, as Mirjana and Alejandra were just saying, all of this work is really highly policy relevant. Policymakers are looking for this type of research because they need to be able to respond to their constituents who might be pushing back on certain tobacco control policies, particularly raising tobacco taxes, probably the one that all of this group is most focused on. But I really think that the work that is being done here and by actually many other colleagues around the world, some of whom I see are attending today, I can't emphasize well enough how important this type of research is, this policy relevant, application-oriented research really just has real-world implications for policymakers and all the other stakeholders who are involved in the policymaking processes. I really encourage you all to go to the supplement and see the other research that has been generated here on a variety of key topics. Today, we heard about economic costs, which we all know are very real and very significant in terms of how much devastation tobacco use causes to our societies. We heard from Alejandra and Mirjana that it is driving people into poverty. So it has very large equity implications that are very negative. And I really think that the research here is supporting the notion that tobacco control and tobacco taxation are both policies that improve health equity and broader economic equity. So I think we are barking up the right proverbial tree here. And then, as Dr. Dartanto noted, we've actually huge issues that very large misrepresentation, if you will, by the opponents to tobacco taxation about the implications, macroeconomic implications. What we actually see, as Teguh noted, is that tobacco taxation is largely very good for the economy. It's good for employment, generally speaking, and we've seen this in other countries in which we've done this research. We know that it's good for overall production in the economy because, as he pointed out, money just gets reallocated to other things. And what we learn is the tobacco sector is not very positive in general. It has low employment. Obviously, we know it has other negative implications for the economy as well. So it really, this type of research really emphasizes that we have really shown that the economic implications of tobacco taxation are positive and the economic implications of tobacco use are very negative. So those two things pair together very nicely. I recognize we're way past the hour here. I thank everyone for participating today. I again want to thank all of our presenters and all of our researchers in the supplement. I want to heartily thank our editors, Corny Van Walbeek and Mark Goodchild again. They have done really yo-person service here. It is an enormous task to edit these volumes. We're very grateful for that amazing work. And we want to thank Tobacco Control Journal for being interested in this work and for promoting work across regions and really this type of economic work. So we're always very, very grateful for the association that we have with the journal. I think that's it, Margaret. Do we have anything else today? This will be posted on the website, so please spread the word. We will spread the word through our social media channels. Any last words, Margaret?
No, that's it. Thank you, everyone, for presenting. Thank you for joining and staying a little past the hour. But yeah, we share all this on our page as well with the links for everything. But you can find everything through our website or our social media accounts, and then the research teams are presented to. Their information is here as well. So yeah, thank you everyone so much.